Today I am going to discuss about global and national public health nutrition approaches. Malnutrition is an imbalance in energy, protein, or other nutrient intake and is used to refer to both undernutrition and overweight, although it is more commonly associated with undernutrition. Most countries are affected by multiple nutrition challenges. This is commonly referred to as the multiple burden of malnutrition. Malnutrition is multifactorial. A sustainable solution requires a multi-sectorial approach with an understanding of the scope of the problem, why it needs tackling, and how each sector can play a role in combating malnutrition. There has been a global shift from communicable to non-communicable disease in the past 30 years, with the cardiovascular diseases accounting for the greatest number of deaths from non-communicable diseases. Public policies are needed to address the causal factors leading to malnutrition. Civil society can play an important role. A sustainable accountability mechanism needs to be put in the place. The focus of global public health nutrition is to prevent disease, promote well-being, and protect health, which is not solely remaining disease-free. The World Health Organization describes health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. To achieve this, good nutrition is vital. However, the poverty, drought, wars, or political agendas can affect access to enough safe, nutritious food to fulfill individuals' requirements. At the other end of the scale, access to food 24 by 7, a shift towards knowledge based economics, and food becoming a cheap commodity, can lead to overweight and its related comorbidities. Malnutrition refers to both undernutrition and overnutrition and can be considered as an imbalance in energy, protein, or other nutrient intake. Undernutrition can take the form of stunting, a reduction in linear growth of children, and wasting, having lower than normal weight for height. A diet deficient in vitamins or minerals can also cause micronutrient malnutrition or hinder hunger. Both undernutrition and overweight have an impact on population health and are a strain on healthcare systems. Most countries are affected by a combination of nutrition challenges, previously referred to as the double burden of undernutrition and obesity, or sometimes as the multiple burden of malnutrition, when we want to highlight the presence of micronutrient malnutrition, which is the multiple burden of malnutrition. Global nutrition frameworks are required to tackle malnutrition in all its forms. Global nutrition policies, strategic documents, and target setting provide the guidance for individual countries to create national policy to reduce the burden of non-communicable diseases using regionally relevant strategies. These strategies and interventions must ensure they reach vulnerable groups such as poor, malnourished, and food insecure. Childhood malnutrition is of particular concern as it affects growth and ability to contribute to the community. Many intervention strategies and reduction targets focus on improving child malnutrition. Organizations such as WHO, the Food and Agriculture Organization of the United Nations, and United Nations Children Fund are involved in funding, carrying out nutrition surveillance, policy implementation, and target setting. Local government organizations are responsible for setting regional policy, implementation, and monitoring. What is the scope for global public health nutrition? The Global Burden of Disease study provided the first comparative assessment of mortality at a global level and national level, providing a comprehensive examination of the state of the world's health. Analysis of the global burden of disease identified childhood underweight as the leading factor of death and disability. Maternal and child undernutrition contributed to 11% of the global burden of disease. The international community acknowledged this scandalous primacy and included a goal to eradicate extreme hunger and poverty in the 2000 Millennium Declaration. The target was to halve the proportion of people who suffer from the hunger between 1990 and 2015. The prevalence of underweight children under 5 years of age was selected as an indicator. By 2010, childhood undernutrition had dropped to 8th in the most important factors contributing to the burden of death and disability. It remained the main contributor in sub-Saharan Africa. The death toll attributable to maternal and child undernutrition had decreased to 6.7% of the global burden of disease and accounted for 140,000 deaths. Rate continued to decrease, and by 2015, there were 156 million children under the age of 5 years, classed as stunted, and 50 million had acute malnutrition, and 42 million were overweight or obese. Despite remarkable progress all over the world, the leading risks contributing the NCD still varied greatly by regions. The 1990 malnutrition reduced target has not been achieved in sub-Saharan Africa, 32% stunting rate, and Southern Asia, 25% stunting rate, and global childhood overweight rates had risen by 10 million cases. Nearly 2 billion adults aged 18 years and above were overweight, 39% of the world adult population, and more than half a billion, 13% were obese. This picture demonstrates global scale of different forms of malnutrition modified from 2015 with data from WHO, UNICEF, and World Bank. Almost no country in the world is exempt from some form of malnutrition, and diet-related health conditions are still dominating the rank of the global health risk. High blood pressure became the leading risk factor for poor health for the first time, with 1.7 million annual deaths from cardiovascular disease associated with height, sodium intake alone. Other nutrition-related risk factors in the top 20 included high body mass index, high fasting blood glucose, high total cholesterol, and dietary risk factors. Diet low in fruit, vegetables, whole grains, nuts, and polyunsaturated fatty acid, and high in sodium. To quantify this burden of disease, the WHO calculates disability adjusted life years. Only disability adjusted life years can be considered as 1 year of healthy life lost. The sum of these years lost across the population can be used to measure the gap between current health status and the ideal health situation, where the entire population lives to an advanced age, free of disease and disability. By 2012, ischemic heart disease was the leading global risk, accounting for 6.0% of disability adjusted life years. High BMI accounted for 3.8% of disability adjusted life years, round about 3.4 million deaths, while poor diet and physical inactivity account for 10% of DALYs. Three of the top six causes of disability adjusted life years related to coronary heart disease, showing a shift away from the communicable disease to non-communicable disease. Other nutrition deficiencies such as vitamin A, zinc, and iodine deficiency, rated lower, accounted for less than 0.8% of disability adjusted life years. Micronutrient deficiencies are a particular concern for at-risk groups such as pregnant and lactating women and infants, with an estimate that 90% of the deaths from non-communicable diseases under the age of 70 years old could be prevented through lifestyle changes to reduce the risk factors. The 66th World Health Assembly endorsed the WHO Global Action Plan for the Prevention and Control of Non-Communicable Diseases 2013 to 2020. This was created in parallel to the global nutrition targets to create a world free of the avoidable burden of non-communicable diseases. The Global Action Plan offered a paradigm shift by providing a roadmap and menu of policy options established through 9 voluntary targets, including 3 diet-related targets. The Global Status Report provides an update on current non-communicable diseases focused on the 9 voluntary targets. To the multiple burden of the malnutrition, the World Health Assembly established 6 global nutrition targets to guide improvements of global nutrition by 2025 as part of the comprehensive implementation plan for maternal, infant, and young child nutrition. Global Target 1 is a 40% reduction in the number of children under 5 years who are stunted by 2025, from 171 million estimated in 2010 to approximately 100 million by 2025. The global target number 2 is a 50% reduction of anemia in women of reproductive age by 2025, from 29.4% estimated in 2012 to 14.7% by 2025. And the global target number 3 is a 30% reduction of low birth weight by 2025, from a 2012 baseline of 15% to 10%. Global target 4, no increase in childhood overweight by 2025, keeping global prevalence to 6.7%. Global target 5 is increase exclusive breastfeeding rates in the first 6 months to at least 50% by 2025, from the 2006 to 2010 estimate of 37%. Global target number 6 is the reduce childhood wasting to less than 5%, from the 8.6% estimates in 2010. Progress data are collected on 5 of the 6 global nutrition targets. Reduction in low birth weight not collected, but the availability of the data are uneven. 74 countries which provided the data, 70 were on track to meet at least one target. Kenya was the only country on track to meet all 5 targets. For a full breakdown of the country progress, refer data from the Global Nutrition Report. Address the nutrition challenges. Multiple sectors must be coherently developing policies that are explicitly aimed at improving people's nutrition status. The term nutrition sensitive and nutrition driven have been used to indicate these programs which help scale up nutrition specific policies and intervention. Action is required in all sectors, particularly across the food system. Collaborative approaches from production to consumer are needed, including education, social protection, and environmental policy. The engagement of multiple actors, in addition to governments, have been considered a necessary step to ensure full alignment of the resources to improve nutrition. This must include the civil society, academia, and the private and not-for-profit sectors. At global level, formal discussions of nutrition priorities and policies have taken place in 3 member state bodies: the WHA, the Committee for Food Security, and the United Nations General Assembly. The greatest level of integration and the broadest scope was achieved with the Second International Conference on Nutrition, which was held in 2014, shifting the focus to non-communicable diseases. The WHA, which is the World Health Assembly, is the highest body discussing health matters. It meets annually in Geneva to discuss major public health issues, make global health policy decisions, and guide the work of the WHO. The World Health Assembly makes formal decisions or resolutions. The first meeting of the World Health Assembly was held in 1948 and had 55 member states. In 2016, the World Health Assembly held its 69th assembly and had grown to 194 member states. Nutrition has been a concern of the World Health Assembly since its very beginning, with concerns focused on severe acute malnutrition in the early years. In 1949, the World Health Assembly called for the establishment of national nutrition committees in collaboration with the WHO and FAO. More than 20 years later, the WHA discussed the outcomes of the World Food Conferences, which also focused on eradicating malnutrition, declaring every man, woman, and child had the right to be free from hunger. At that time, the World Health Assembly recognized the importance of good infant and child nutrition and identified that the global decline in breastfeeding rates worldwide was due to the aggressive marketing of infant formula, particularly in developing countries. As a response, the WHA adopted the International Code of Marketing Breast Milk Substitutes under the resolutions of 34.22 in 1981. In addition to the code, other World Health Assembly highlights are the endorsement of the Global Strategy on Infants and Young Child Feeding and the endorsement of the Comprehensive Implementation Plan on Maternal, Infant, and Young Child Nutrition. The latter includes the addition of the maternal nutrition and focuses on a life course approach. It also establishes the six global nutrition targets, providing a more comprehensive scope to nutrition policies. The implementation plan expanded and updated previous policy documents on infants and young child nutrition and complemented the diet and physical activity strategies that had been developed specifically to address diet-related non-communicable diseases. The implementation plan flagged the importance of addressing the nutrition in sectors other than health. It considered agriculture and food production, trade, education and information, labor and social protection, and the environment, recommending that other policy involving those sectors be engaged to make the recommendations. The infant and young child feeding strategy was jointly developed by WHO and UNICEF with the aim of improving infant nutrition, health, and growth through optimal feeding practices. The strategy is based on scientific and epidemiological evidence and is intended as a guide for action on feeding practices. It provides guidelines for intervention, promotes best practice through supporting mothers and families, and outlines key stakeholders and accountable organizations, as well as reiterating the importance of good feeding practices. The strategy was designed to strengthen the commitment to established initiatives, particularly the Code of Marketing of Breast Milk Substitutes, the Innocenti Declaration on the Protection, Promotion and Support of Breastfeeding, and the Baby Friendly Hospital Initiative. It aims to build upon these, emphasizing the need for comprehensive guidelines to promote and support appropriate infant feeding, promote exclusive breastfeeding for 6 months, and improve complementary feeding practices with support for using local foods, food fortification, and micronutrient supplementation, while protecting breastfeeding or from commercial influences. The strategy outlines interventions to promote and support infant and child feeding, highlighting the importance of investing in this area to ensure children develop to their full potential. It provides governments and societies other main agents with both a valuable opportunity and a practical instrument for dedicating themselves individually and collectively to protecting, promoting, and supporting safe and adequate feeding for infants and young children. World Health Assembly Comprehensive Implementation Plan on Maternal, Infant, and Young Child Nutrition provides the guidelines on how to design national nutrition policies and recommends to create a supportive environment for the implementation of comprehensive nutrition policies, include all effective health interventions in national nutrition plans, stimulate development policies and programs outside the health sector that recognize and include nutrition, provide sufficient human and financial resources for the implementation of nutrition interventions, monitor and evaluate the implementation of policies and programs. Effective nutrition interventions during the life course have been evaluated by the Lancet series on maternal and child undernutrition. The WHO is continuously reviewing the evidence on direct nutrition interventions and has been developing guidelines on effective programs to achieve nutrition outcomes. In recognition of the increasing burden of non-communicable diseases, DPA was endorsed by WHA. DPAs addresses the two main risk factors for non-communicable diseases, that is diet and physical activity, and made certain recommendations which include to reduce the trans fatty acids and salt, to restrict availability of energy-dense foods and high-calorie non-alcoholic beverages, to increase availability of healthier foods including fruits and vegetables. The TPAs indicate the policy priorities which includes to practice responsible marketing of unhealthy foods to children, to make healthy options available and affordable, to provide simple, clear and consistent food labels that are consumer friendly, to reshape industry to introduce new products with improved nutritional value, to make physical activity accessible in all settings. The follow-up to TPAs was the approval of a WHO set of recommendations on marketing foods and beverages to children, aimed to guide efforts in designing, strengthening, and existing policies on food marketing to children in order to reduce the impact of marketing foods high in saturated fats, trans fats, free sugars, or salts. The WHO discussed the Commission on Ending Childhood Obesity. The commission was established to guide the WHO response to the obesity epidemic and recommended a suite of interventions to effectively prevent and treat childhood and adolescent obesity. The commission promotes healthy foods, discourages the unhealthy eating, and promotes physical activity to fight sedentary habits. The Commission also called for appropriate guidance on obesity and non-communicable disease prevention and preconception and antenatal care, and the provision of family-based, multi-component lifestyle weight management services for children and young people who are obese. The Committee on World Food Security was established in the United Nations system, recognized the need for an intergovernmental body to review food security policies, hosted by the FAO, and Committee of World Food Security was later reformed in 2009 to maximize stakeholder input. The vision of the reformed CFS was to be an international intergovernmental platform for all stakeholders to work together to ensure food security and nutrition for all. The high-level panel of experts on food security and nutrition was created to provide independent, evidence-based analysis and advice. The findings from the HLPE are used as the basis for CFS policy discussion. The CFS reform document states that CFS strives for a world free from hunger, where countries implement the voluntary guidelines for the progressive realization of the right to adequate food in the context of national food security, and that CFS constitutes the foremost inclusive international and intergovernmental platform for a broad range of committed stakeholders to work together in a coordinated manner and in support of country-led processes towards the elimination of hunger and ensuring food security and nutrition for all human beings. The Global Strategic Framework for Food Security and Nutrition was created as an overreaching framework and reference document in response to rising hunger and unconnected governments on nutrition and food security around the world. The GSF was initiated by the CFS to provide guidance, strategy, and action on the nutrition policy. The focus of the GSF is the importance of coherence across all sectors which have an impact on food security. The GSF looks to strengthen coordination between a wide range of stakeholders to improve global food security, serving as a reference document to guide countries to improve nutrition. The GSF is described as a living document which is flexible and can be adjusted as priorities change. The framework emphasizes the role of country ownership and the responsibility of individual governments in combating food security and malnutrition. It serves as an essential tool for policymakers and stakeholders involved in nutrition and food security at a global, regional, and country level. When creating GSF, all prior recommendations and frameworks were considered to reflect the current state of the evidence based on the cross-country consensus. The GSF uses a twin-track approach which strives for a comprehensive approach to address food security and malnutrition. This approach consists of direct action to immediately tackle hunger for the most vulnerable groups who are unable to meet food and nutrition requirements, and medium long-term actions to build resilience and address the root causes of hunger, focusing on sustainable agriculture, food security, nutrition, and rural development, including the continued realization of the right to adequate food. Linkages between the tracks is vital to connect the immediate and long-term interventions. For example, social protection can form the bridge between humanitarian aid in crisis and long-term investment into infrastructure. The framework highlights the importance of investing in small-scale food producers as they play a central role in feeding the community. It pays particular attention to the role of women food producers who need specific policies and support. This includes actions to increase food production and availability using coordinated approaches to reducing the price volatility, as this has a greater effect on high risk groups. Action must be taken to improve nutrition. Measures should be taken to strengthen dietary diversity and improve healthy eating, ensuring access to food does not negatively affect intake and dietary compositions. These nutrition interventions should include education, labeling, and information involving all relevant stakeholders. The nutritional needs of vulnerable groups must be addressed. Breastfeeding should be encouraged and promoted in line with the International Code of Marketing Breast Milk Substitutes. In 2015, a work stream on nutrition was established. The CFS will work as a form of policy convergence work on nutrition and food systems, aiming to formulate policy recommendations, international strategies, voluntary guidelines, principles, and other policy frameworks, share lessons and good practices that are relevant to CFS work on nutrition and food systems, report on the implementation of the ICN2, recommendations for sustainable food systems promoting health diets, raise awareness of CFS stakeholders in nutrition. CFS is committed to include a nutrition lens in other policies, such as the GFS. CFS is also recognizing the need for multi-sectoral collaboration on nutrition to bringing agriculture, food security, nutrition and health together, and is working towards the establishment of a two-way communication between CFS and WHO. Good governance and coordination between stakeholders are key requisites in the fight against hunger and malnutrition. This should be through strategies, programs, policies, and funding, with cross-sectorial government support to implement the Right to Food guidelines. Brazil have been pioneers in implementing the right to food through government and civil society collaborations. What is the success story of a government and civil society collaboration? In 2002, as part of his inauguration speech, Brazilian President Luiz Inácio Lula da Silva declared he would eradicate hunger and poverty in Brazil. In 2003, at a time when 40% of the population reported food insecurity, the Zero Hunger Strategy was implemented. The aim of the strategy was to tackle food and nutrition insecurity across Brazil's 11 million people poor families. As part of this strategy, the National Council on Food and Nutrition Security was established as an advisory board to the president to develop policies and strategies to guarantee the right to food. Chaired by a civil society representative comprised two-thirds civil society and one-third government officials. Through a combination of government funding and community-based interventions, Zero Hunger has taken 14 million Brazilians out of the extreme poverty, and Brazil achieved the Millennium Development Goal target of reducing the hunger by half, well before the 2015 deadline. Individuals have been empowered through training, community engagement, social inclusion, and price regulation. Governments were made accountable for the right to food. Taking the human rights perspective, Zero Hunger successfully implemented 52 programs which include Bolsa Familia, a family allowance system. National School Feeding Program uses the local small-scale farming to provide 47 million children with school meals. Support for small-scale food producers based on credit insurance and technical support. Food Acquisition Program for family farmed products. In 2009, the National School Feeding Program were passed as law. In 2010, the right to food was included in the Constitution as a basic human right. By 2011, decentralized CONSEAs had been formed in all of the Brazil's 27 states, responsible for establishing the guidelines for implementing the national policy on food and nutrition security. Owing to its widespread success, Zero Hunger has provided a conceptual framework for initiative throughout the lands of Latin America, Asia, and Africa. United Nations General Assembly is the most important forum for intergovernmental policy discussion. While nutrition issues have not been prominent in the plenary discussion, they have been considered in the Convention of the Right of the Child, in the United Nations Millennium Declaration, in the Political Declaration of the High-Level Meeting of the General Assembly on the Prevention and Control of Non-Communicable Disease, and most recently in the 2030 Agenda for Sustainable Development. United Nations General Assembly approved the 2030 Agenda for Sustainable Development, a plan of action for the people, the planet, and for prosperity. Nutrition appears as a powerful driver of sustainable development. It is explicitly mentioned in the second goal to end hunger, achieve food security and improved nutrition, and promote sustainable agriculture. Nutrition also has a role to play in achieving other goals of the 2030 Agenda for Sustainable Development, such as the goals related to the poverty, health education, gender, work, growth, inequality, and climate change. To achieve the good health and well-being goals, good nutrition throughout the life course is needed. particularly to reduce maternal mortality and newborn and child mortality, and end premature mortality from non-communicable disease. Optimum nutrition is required to achieve social development and economic development goals. Improved eating patterns would also allow substantial environment benefits. The 2030 Agenda for Sustainable Development looks to end malnutrition, address nutritional needs throughout the life course, and provide access to safe, healthy, and sustainable food. Food security matters have been discussed in the Economic and Financial Committee. The 2014 report of the Secretary General of the United Nations on Agriculture Development, Food Security and Nutrition highlighted the double burden of malnutrition and called for the need to address the different dimensions of malnutrition. The United Nations General Assembly has endorsed the International Conference on Nutrition Outcomes and declared a decade of action on nutrition. Thus effectively has created a new multi-sectoral forum on public health nutrition. Recognize the need for collaborative, multi-sectoral approaches. The WHO and FAO convened the ICN2, which is the Second International Conference on Nutrition. Building on the 1992 International Conference on Nutrition, which focused efforts on reducing hunger, malnutrition, and micronutrient deficiency, recognize the new dimension to malnutrition, obesity, and diet-related non-communicable diseases. World leaders made commitment to tackle malnutrition in all its forms and committed to fix the global food system so everyone has access to safe, healthy, and affordable diets. The Rome Declaration was the outcome document of ICN2. The declaration considered the broken food system. It reviews the challenges of providing food security for a growing population whilst recognizing the complexity of malnutrition. The document sets out a vision for a world with coherent policies to promote a diversified, balanced, and healthy diet at all stages of life, with national health systems integrating nutrition, coordinated action among different actors and sectors, empowerment of consumers, and policies that pay special attention to women. The Rome Declaration recommends a set of policy and programs designed to create an enabling environment to improve nutrition. These options cut across all sectors, including substantial food systems, international trade, and investment. Members of FAO and WHO have committed themselves to the different commitments, which include to increase investment for the effective interventions and actions to improve diet, to develop coherent policies from production to consumption and across relevant sectors to provide year-round access to food that meets nutrition requirement, to raise the profile of nutrition within relevant national strategies, policies, action plans, and programs, and align resources accordingly, to strengthen human and institutional capacities to address all forms of malnutrition, to strengthen and facilitate the contributions by all stakeholders to improve nutrition and promote collaboration within and across countries, to develop policies, programs, and initiatives for ensuring health diets throughout the life course, to empower people to make informed choices about food products for healthy dietary practices and appropriate infant and child feeding practices, to implement the commitments through the framework of action, a set of voluntary policy and strategy options to create an enabling environment to improve nutrition. The United Nations Conference on Climate Change presented an opportunities for those involved in nutrition and climate change to work together to advance their overlapping agendas. The Paris Agreement recognized the priority of safeguarding food security and ending hunger and the vulnerabilities of food products to the adverse impacts of climate changes. It called for the adoption of measures to reduce greenhouse gas emission in a manner that does not jeopardize food production. The agreement highlighted the importance of the co-benefits of mitigation actions for adaptation, health, and sustainable development. The implementation of such complex agendas spanning several sectors requires the engagement of other actors as well as governments. Such actors may act in the interest of specific groups they represent or in public interest. The private sectors has a primary responsibility for the food that reaches our tables. But there are several actors in the food system: primary producers, farmers, fishermen, livestock farmers, food manufacturers, food distributors, and food retailers. Political choices and investment at each stage of the food system affects the availability, cost, product appeal to consumers. Consumers' demand is not only linked to the personal preferences, it is heavily influenced by commercial variables and expectations of profit by company shareholder. Highly processed products are better suited to a global food system and allow greater financial returns. Standardized products sold in large fast food chains can be better marketed and have greater taste and quality control. Trade liberalization has been associated with an increase in the risk of nutrition-related non-communicable diseases, as large multinationals have been major financial returns in expanding their markets to low and middle-income countries. Food companies have offered to provide nutrition education to consumers or support government initiatives to address malnutrition through corporate social responsibility schemes. These approaches have been criticized as giving rise to conflicts of interest. Civil societies can perform an important role in improving the nutrition in a variety of roles. They represent citizens in policy dialogue, advocate for the establishment of policies and programs, monitor the commitments of policymakers and other actors, and assist governments in the delivering of services. Public interest non-governmental organizations include organizations defending consumers' rights, organizations protecting human rights, and international aid organizations. In nutrition, an example is that of the Scaling Up Nutrition movement. The Scaling Up Nutrition movement was launched in September 2010. Scaling Up Nutrition brings together representatives from governments, civil society, United Nations donors, businesses, and researchers, with a core focus on empowering the women. SUN countries are collectively aiming to reach the WHA global targets. Countries joining are asked to commit to nutrition at the highest political level through four strategic processes: sustained political commitment and establishment of functioning multi-stakeholder platforms, endorsement of national nutrition policies that incorporate best practices, alignment of actions across sectors and among stakeholders through high-quality and well-crossed country plans based on agreed result frameworks. The increased resources for nutrition and demonstration of results. The December 2016, 57 countries were members of the SUN movement.